I'll be discussing about the big treatment flare-ups of the endodontic. Okay, it is an endodontic topic, and flare-up is nothing but a severe kind of pain and swelling, which is seen from the patients in between the visits. Once the root canal treatment has been started, if the patient comes in between the visits with a severe pain, or even after the completion of treatment also, if the patient comes with an unappointed pain, they will come to a class, then it is called as a flare. Okay, we will continue with this. Coming to the introduction part, this is the root canal treatment. They have started the axis opening. Okay, they have cleaned and shaped the canal. Okay, there is an infection periodically. So this condition is usually, if at all there is no abscess, then it is called apical periodontitis. It is acute and chronic dependent, but a flare is usually acute condition. So it is symptomatic of apical periodontitis. Okay, flare up means patient will come to us with a pain and swelling dependent condition. Okay, so cleaning and shaping of the canal. Okay. And here, after the completion of cleaning and shaping, that is chemico-mechanical preparation. Chemical means chemically we are using irrigants, antibiotic irrigants or whatever it may be. We are using irrigant, it is called chemical. Mechanical means we are filing that rules. So that is called chemico-mechanical preparation. Okay, biomechanical preparation, chemico-mechanical preparation, cleaning and shaping other than. Actually, we have to say shaping and cleaning. Because once we shape with the files, then we will be using the irrigants in between. Okay. After this, then we will provide a temporary. In the second visit, if the infection is very much too much infection, then we will provide a medicament inside, or then we will provide a cotton in between, and then a temporary filling. Okay. If at all the treatment is completed, we have cleaned and shaped the canal, and the infection is not there, then we will go with a filling of the roots first with a gatta pacha, material called gatta pacha. Okay. We will fill the canals, and then we will place a temporary restoration. Okay. Temporary restoration till the original plan building. Okay, till they'll take the measurements of the crown, and then we'll go with the crown further. Okay, processes further. Okay, in between, if the patient is fine, no symptoms at all, after the root canal filling and everything, then we'll do the core build-up. Core build-up will be done. Okay, core build-up means they will close the orifices with a permanent restoration. Okay, either it might be a basic. There is very little axis opening, then we will provide a composite unit of living processes. Okay, but the axis opening is very wide. The tooth structure is almost removed because of the caries. Then we have to provide a strong material. That is, after restoring the core build-up, then we have to provide a crown. Okay, this is the basic endodontic treatment aspect. If the patient comes in between this, after the cleaning and shaping, if we left for the second visit for the root canal filling. If the patient comes in between with a severe pain, then we call it as flare. Okay. Even in between, after the completion of root canal treatment, before placing of the crown, or even after the placing of the crown also. But usually we provide time after the completion of treatment, and before placing the crown, we will give before placing the crown is nothing but a process. Okay. Before placing it, we will provide a time limit. Okay. Even for the manufacturing also takes time. In between, we will give some time for the patient so that if there are any symptoms, okay, the patient comes even after the completion of root filling also, then it is also called as an flare. Okay, this is a basic introduction of the flare. Okay, then we'll see what are the incidents. To what extent will get the flares. We will be doing all kinds of treatment and proper indication, proper protocol is followed. Still, flares can be seen. Okay, the instance it is really rare actually. The patient comes. The percentage to what extent we could see the flare-up is 1.4 to 1.6%. And this flare-up is directly proportional. Means if there is a previously pain before initiation of root canal treatment, if the patient is with severe pain, then there are chances of getting flare-ups. Okay, directly proportional means if there are severe pain before the treatment, then there might be chances of getting the flare-ups in between the treatment as well. Thereafter, this is directly proportional. Okay, you got till here, right? And next. The different journals have given about the flare-up definition. Okay, JOE Journal of Endodontics. It is defined as a pain or the swelling that requires an unscheduled patient visit and active intervention by the dentist. You got this right? It might be a pain or swelling. With a severe pain, they will come to us. Okay, unscheduled appointment. That is the main thing. Because of severe pain, they will rush to us. Unscheduled patient visit and active intervention should be done because of its acute condition. Okay, and according to the AA periapical pathosis. Acute exacerbation. Do you know about any Phoenix abscess? Phoenix abscess is also nothing but it will be the chronic condition, but because of the secondary infection or changing the environment or whatever it might be, it changes into the acute condition. Changing from the chronic to the acute, it results in acute Phoenix abscess. We call it as Phoenix abscess. Okay? An acute exacerbation of periradicular pathosis. Periradicular pathosis. Okay? After the initiation or continuation of root canal treatment. After the initiation means while we are cleaning and shaping. Before to the treatment, we will be in a stable conditions, but because of pain, they have come to us. We have started. Here, what happens? We are foreign word. We are giving an irritant, let us say filing or irritant or whatever it reaches the periapical region, right? Here, because of the stable condition has been disturbed, the balance has been disturbed. That causes irritation, causes flares. Okay? Initiation or continuation of root canal treatment. It is nothing but in between visits. Continuation means in between the visits. According to the International Endodontic Journal, a severe problem requiring an unscheduled visit and the treatment. All means the same, but they have different definitions. And etiopathogens, what might be the causes of this flare? Okay, according to the Cohen, he is one of the very famous author. If you go to the endodontic, they will talk about two authors, Cohen and Endo. Okay, he is one of the very famous author. According to the Cohen, the contributing factors for this flare are solved. Okay. Inadequate debridement. See that there will be complete. This is the complete root, right? This is the complete root. We have to remove the pulp till the apex. Okay, whatever the pulp is there, it is infected, so we have to remove it. Inadequate removal. That is inadequate debridement. If we leave some amount of pulp, it is still infected, right? If we remove some amount of pulp, that is incomplete debridement. Debridement is completely debriding off, cleaning off. Okay, if we leave some amount of pulp, then it may result in a reinfection. So without cleaning and shaping, we are filling the canal. Okay, then what happens? The infection again goes within the canal. It might result in the flare. Okay, incomplete debridement. Okay, debris extrusion. Debris extrusion means this is still here the apex. Okay, while cleaning and shaping, the debris will be there, right? We are cleaning the canals, right? Canal walls. While cleaning it, the debris, whatever it may be, even the saliva, but actually we will be using the burden. Okay, but still some amount of saliva or the bacteria or the irritants or the debriding canals will be finding the canals, right? The canal matter. Whatever, if at all it enters into the periapical region, everything will be a foreign object in the periapical region. Okay, it used to be within the canal, but because of the instrumentation or extrusion, the debris extrusion to the periapical region, that may result also with the flares. Okay. Next is over instrumentation. We have to stop till the apex. Okay, apical delta is one of the terminology you have to know. Till apical delta, we usually stop the filing. Filing is cleaning of the delta. If we extrude it, if we break the delta, it easily enters into the periapical region. In such cases, easily the debris or the irritants or whatever it might be easily enters into the periapical region. Okay, in such kind of over instrumentation is also one of the factors of the flares. Okay, inadequate debridement. If we leave the pulp also, it may cause debris extrusion. While doing the preparation also, if it extends into the periapical region, it will result. And other is over instrumentation. There is over instrumentation also. The results are there. And there is overfilling. Yes, completely we have done excellent root canal treatment, excellent cleaning and shaping, chemical mechanical preparation. But after that, if at all we place gutta percha as the material, right? That material, if we place beyond the apex, it means that it entered into the periapical region, right? If it enters, it is a foreign body to the periapical region, right? So if at all there is any foreign body, there will be irritation. It results in the flare. It is also one of the contributing factors. Another is retreatment. Yes, usually thing is, yeah, we have done treatment. Once someone has done the root canal treatment, it is completed. But still patient comes to a doctor after saying after a few months or years saying that even after they were on treatment I'm still having pain. Okay, so what we do is we will remove it, start opening it, removing the things and so on. So we are retreating the treatment. Okay, in such conditions also once we are filing it and doing it is the Till then it will be a balanced condition over there, balanced environment over the periapical region and within the canal as well. Okay. We are removing and we are inserting the filing and irritants or whatever it might be. Again, it acts as a foreign body or an irritant to the stable conditions. Okay. In such field treatment cases also there are chances of the flare-ups. Another is periapical lesion. I said earlier, right, directly proportional. If there is a periapical lesion and they have completed excellent root canal treatment without treating the periapical region, okay, then leaving of them, it may later get irritated and then results in the flare-ups. Okay, even after the root canal treatment. This is okay, and this is a simple flowchart. I will just briefly explaining it. Three factors might be there. Physical factors. Physical means using of physical things like filing. Okay, whatever we use, the files and all, those are the physical things. Bacteria. Some amount of bacteria will be present within the canal and periapical region. Okay, and the chemical. Chemical is what are the ingredients, medicaments what we are using within the canal. Those are the chemical aspects. Okay. Physically, if at all we do something like over instrumentation, okay, or leaving of under instrumentation, those all comes and even the debris extrusion. Everything these are the physical matters, right? So, because of that, there will be the tissue damage in the periapical region, which results in the inflammation. This inflammation will be learning in the biomechanics, right? Biochemistry, everything. Okay, chemical mediators will be released. This results in the release of the exudate or transudate or exudate, whatever it might be. This exudate creates a pressure within and causes a severe pain and swelling. Okay, this is the physical aspect. Bacterial aspect. If this bacteria directly may present within the canal or even the periapical directly may cause an infection, results in the inflammation and the same vesicles. Okay. Otherwise, if at all the bacteria present, it may stimulate the immune system. Okay. Immune responses might be active and it again causes the inflammation and the following. Okay. This is the other condition. You understood this, right, the closure? And now we will go through each and everything. Inadequate debridement. I said earlier, if there is an inadequate debridement, the remnants of the hull which may result in the further infection in the future, that may cause the flare. Okay. These are just the images. See, debris extrusion. Here they have done under restoration. Okay, this is the GP point. If you take an X-ray, it will appear in an opaque condition. Okay. See, here they having till now they having filled it, but they have completed the root canal. And debris extrusion was their condition, so it resulted in the secondary infection. Okay, and here over instrumentation. Here this is the apex, but it has crossed beyond the apex. This is called over instrumentation. And here overfilling. Still here are the apex. You can appreciate this, right? Still here are the apex, but the GP points are extended beyond the apex. It acts as a foreign body to the cervical, periapical area. It again results in the flare. And he is one of the famous author, Dr. Seltzer. He discussed about the hypothesis of these flare-ups. Okay, he gave hypothesis on the flare-ups based on these points. Okay, alteration of the local adaptive system. Okay, local adaptive system is where if at all the condition is a chronic condition. Okay, though there is an irritant they have been removed, but still chronic conditions means it has the irritant has been adapted to the particular environment. Okay, but if we enter or if there is any secondary infection or if we started the root canal treatment again, okay, it acts as a new irritant, disturbing the local adapted irritant. That is called alteration of local adaptation system. Okay, another is changes in the periapical tissue pressure. Okay, usually there will be certain pressure in the periapical area and within the canal. Okay, within the canal will be the atmospheric pressure. If you open, atmospheric pressure will be there. And beyond the canal there will be periapical pressure. Okay, if there is an increased periapical pressure, okay, the exudate has been formed already because of the inflammation. Okay, where the way that the exudate can go, there is no chance at all. Okay, it has to go because it will develop severe pressure so that the patient can't bear the pain, they will rush to the dentist. Okay, then immediate access only will be doing, will be extricating the hull. Immediately the exudate which is present over there, the exudate or the abscess which is present over there, it will oozes out from the canal. Okay, you might be seeing a severe swelling in the patient, but once they go to the dentist, they will debride the canal. They will make the patient sit outside so that all the exudate will come out or the abscess will come out. After that, after complete extrusion, if there is no further extrusion, then If today coming out, then they will ask the patient and they will give the dressing. Never ever open, make some dentists will be doing it without any knowledge that they are not opening, they are not leaving for one day. They are not leaving for one day, sorry. Okay, after opening the canal, because of the abscess extrusion and they might be not having time or whatever it may be the reason, they will ask the patient, they will put a quarter and ask them to come the next day. Okay, we should never do that because the oral cavity is a bunch of bacteria over there, millions of bacteria over there. Whatever the food we take, the saliva, everything they are having bacteria. So they again enter into the canal. You are still more damaging the periapital tissue. Okay, changes in the periapital tissue pressure. Okay, we need to briefly will go through. Okay, and microbial factors. Within the canal there will be some amount of bacteria, some species of bacteria, and within the periapital region also will be having bacteria. Effects of chemical mediators. Because of this inflammation involved, the chemical mediators become active at that area, resulting in the inflammation and release of excreta and water. Okay. Changes in the cyclic nucleotides. Again, these are the secondary mediators for the hormones, whatever to be acted on. Okay. And immunological phenomenon. Immunological phenomenon also acts over there. Okay. The patient is strong enough to